Hello, I'm Dr. Pramod Bhor, Director of Orthopedics, Fortis Hospital, Vashi. Today it gives me an immense pleasure to inform all of you that we have completed more than 100 robotic joint replacement surgeries at Fortis Hospital, Vashi. It has been a great journey uh, with the help of all my team. I thank all the patients also who have had their confidence in me, so allowing me to do all these surgeries with them. uh, Over the last 1 year, where we have been doing this robotic surgeries at Fortis Vashi, we have learned a great deal in terms of how to manage, how to help these people, and how robotics is really helping with modern techniques. So, coming down to the basics, let us see what is knee replacement. So, knee replacement is done for patients who have severe osteoarthritis of knee, that is having pain, chronic pain rather, I would say, in the knee, majorly in the elderly age group. So this is a normal knee joint where it is the cartilage is soft. With chronic osteoarthritis, this is what happens to the joint. The cartilage is completely worn out and there is friction in the joint and the patient has pain. So what do we do in a knee replacement is this, that we are resurfacing the femur, that is the thigh bone, and the tibia, that is the leg bone, by metallic plates, that is cobalt chrome, titanium neobiochrome, different materials that are there. And along with that, there is a polyethylene spacer in between, which allows uh, the deformity to get corrected, plus lesser amount of friction in the joint. So this is done in a normal knee replacement. So while doing this normal replacement, which I was doing since many years, so like 17, 18 years that I have been doing these surgeries, I have been doing it by the conventional approach. We have upgraded ourselves along with time in the surgical technique. So we are doing the surgery using conventional technique. We are able to give patients satisfactory results. But coming down to the robotics, it is basically an advanced technique where I am able to tabulate what I am doing. I am really able to know whether I am able to balance both those ligaments. This is the inner and the outer ligament, whether I'm able to balance this gap properly and how much gap is different, the difference is there. I'm able to tabulate that. Plus, the advantage of robotics is that whenever I'm doing the surgery with using robotics, I do not have to open much, the lesser soft tissue dissection, leading to lesser amount of pain. So this is what we have seen over the year, that to a conventional surgery, post-operative pain in a robotic surgery is around 30 to 40% less as compared to the conventional surgery. Plus, uh, because there is lesser soft tissue dissection, lesser bone dissection, bone loss, there is lesser amount of blood loss also. So quite a few patients where I have done bilateral knee replacement, both the knees at one go, I have never had to need to give a blood transfusion in any of the cases. So that is a bigger plus point when I talk about robotics surgery. So robotics is basically perfection. It is basically uh, it gives perfection up to a sub-millimetric accuracy. It is normally allowing me to cut the bone lesser and less, balance the soft tissue as least as possible, or handle this tissue as least as possible, and give better results to the knee. Most important thing that I feel is that I am able to give whatever best results that I was able to give to the patients, to each and every of the same patient, because it is the planning is same. I know the final result is going to come the same. There is no deviance from the best result that I want to give. So this is an advantage of having an artificial intelligence help you, where it is going to give us a final result. So the robot that we are having at Fortis Vashi is the only fully automated robot that is there in the whole world. This is it is the CT based robot, where I do a CT scan of the patient one day prior to surgery and do a virtual surgery on a laptop with the software, where I know how much bone is going to get cut, how much deformity can be corrected, how the implant is going to fit, and the size of the joint and size of the implants one day prior to surgery. This gives me an advantage in planning. Plus, at the time of surgery, I have to do lesser dissection because of this software. Plus, robotic surgeries, it is a very safe instrument in terms of many of my patients have asked me this question, so whether the robot is safe. So basically, I have told them that I am doing the surgery. The robot is assisting me. The robot only comes in play when the bone cuts are to be made, and it is a very safe instrument in terms that it never goes near any soft tissue. No muscle, no blood vessel or nerve or anything comes near the bone. It is only cut near the robotic arm. It only goes near the bone where the bone is cut. The haptic arc, that is the basic thing where it has to move. It only moves in that angle. It doesn't move any other way out. That is the advantage. It is a very safe instrument, safe this thing, and a perfection. Most important thing, again and again, I would be repeating this. That is the sub-millimetric accuracy that I am able to do. So earlier with conventional way, I had used to cut only 9 mm or 7 mm bone according to what is needed. Now I can go to 8.1, 8.2, 8.3, whatever amount is needed. I don't have to cut more. So that gives me an advantage in alignment, in attaining the best fit implant that is there. Thank you, Cubis. Thank you, Fortis, for helping, allowing me or giving me the opportunity of doing this robotic surgery. Thank you.